All right, I think I'm just gonna start and kick this off. Welcome everyone. I think we'll have more people because we have more people registered. I see Travis is admitting still people, but for the sake of time and getting this presentation and some questions, I'm sure that's going to be in the end. I'm gonna welcome our speaker, Nancy Dijon, who is a fellow veterinarian, which I'm so excited. She lives right near me in New Jersey. And I'm very excited to, talk about this. So, Nancy, I'm going to turn it over to you. And we'll hold, I guess, questions until the end.
I think if anybody wants to ask, that's fine. They can
Very good.
interrupt. Yeah,
Okay. And I'll monitor the chat room if anybody wants to do that. It would be helpful if you all just put your name and your village in the chat. Would be great to have Nancy know where you all are located. And I can tell, just by looking at you guys where you are. So it helps to, very familiar faces. So without further ado, Nancy, why don't you go ahead?
Thank you so much, Barbara. And thank you everyone for joining us. I'm real excited to be given this opportunity to tell you a little bit about our company, HandsFree Health, what we do and the service we provide. What I'll start with first is how we got started, who our leadership team is. Did somebody have a question? Okay. So our company was founded by several former Aetna Health executives. Our CEO, Mike Cardillo, he was the president of Aetna Health. And then after he left Aetna Health, he was one of the CEOs and co-founder of Health Advocate, which is a healthcare concierge company that employers would use for their employees so that they can navigate the healthcare system. And then our president is Dan Messina, and he was the CEO of Magellan Health and the CFO of Aetna Health. And he was also another one of the partners from Health Advocate. And Kelly Johnston, our senior vice president and chief operating officer, she has over 30 years experience in healthcare product development and operations. And she also was with Mike and Dan at Health Advocate. And just as a side note, I also worked at Aetna for over 25 years. So we all kind of came from that background of healthcare and have a real passion about it. And then to round out our leadership team, we have Eric Weaver. He was one of the people who did not come from Aetna, but he was the CTO over at Health Advocate with the rest of our leadership team. And he brought a huge knowledge of information in technology, because we were all healthcare people. We weren't technology people. So we really needed to have someone on our staff that was good in technology. So what's different about HandsFree Health? I don't know if you had an opportunity to look into us at all, but we have built a technology platform that houses several different types of devices that you can use. And what's unique is that we are one of the few companies that are HIPAA compliant. So whenever you're using our products, you can be sure that your private information is safe and secure. And coming from a health insurance background, we knew how important that would be, and we knew how to do it right. We were part of the Microsoft startup team, so we have the benefit of having the backing of Microsoft, which really helped us develop a lot quicker and allowed us to really be in a growth mode. So it was great to be partners with Microsoft. And a couple of new things we added is Spanish capabilities to our platform, and also ChatGPT. So they make us very, very unique. And I talked a little bit about the HIPAA compliant technology. What's important about that is there's no third-party development on our platform. Like a lot of people would say to us, look, why don't you just build a skill on Amazon Alexa for your platform? And we're like, we can't do that because we then would not be able to maintain our HIPAA compliant feature. So that was very, very important to us. And we didn't want a bunch of developers on our platform developing skills. We wanted to have control of that because we wanted to strictly be a platform that focused on healthcare, well-being, safety, connection. So we did not want to have a whole bunch of different skills on our platform. And it's a voice-enabled platform, so you can interact with it with your voice. So we found it very important that your voice be able to be recognized. So we have that natural language processing and speech recognition technology. And I think this is a really good slide just as a visual to help people to understand that technology is important when you're talking about caregiving and your health and support, but it's not to replace the human interaction, people that are caregivers and health providers and things of that. It's just supposed to be augment that care, be part of that solution of caregiving and health support. So this kind of gives you an idea of some of the features on our platform. Some of these features are only available on an enterprise solution. So like if we were going to be entering a senior living facility and all the members were going to be using our devices, we would be able to have things like medical device integration and vital tracking of your vitals with those medical devices and have it upload right into the system, as well as smart home integration. But a lot of these other features are part of the basic platform that we offer, which is you can set it up via an administrative app for medication reminders. You can search for doctors and hospitals and urgent care centers in your geographic area. You can set it up for prescription refill reminders. We also have an extensive health library with health content that you could ask medical questions or health questions. As I said, it's a voice-enabled platform, so you can interact with your voice and ask questions. We have emergency calling. So whether whatever device you use, there is that emergency feature where it can go directly to an emergency call center and you can get help. So you can get appointment reminders. We also have a telehealth feature that some people are interested in. And then what's really important is caregiver notifications. You can set it up where if you're the user of the device, whether it be the watch, the pendant, or the speaker, it can go to the caregiver to send them alerts if you're not complying with any of your reminders or things like that, or if there is an emergency. So this kind of goes over some of the features of the platform. So the first product I'm going to talk about is our smart speaker. You're going to look at it and you're going to say, hey, is it like a lot of the other voice-enabled speakers out there? And it is. It does have the capabilities of entertainment like audiobooks, music, news, and weather. But we have designed it to be specifically about healthcare. So as I said earlier, there's an extensive medical library where you can get reliable health answers. There's 24/7 emergency monitoring. You can just talk to the speaker and say, the speaker's name is WellBe. You can say, okay, WellBe, call emergency, and it'll call emergency contact, or it will call emergency services. You can get your medication reminders and your doctor appointment reminders. And I talked about the chat feature. That's new to our platform, where you can have a very interactive conversation, which we found is really a great solution when a lot of people are combating isolation and loneliness. So we found that chat feature really helps to keep them connected, and you can ask it any topic and it will continue to learn as you talk with the device and continue the conversation for as long as you want the conversation to go on. It also has hands-free calling, so you can use this device just to call out. You can have numbers set up in the companion app that goes with the device to set everything up where you can call out to people or emergency. And you'll see on this slide, there's like that picture of the 6 different devices with different colored lights. When those lights light up, that means you have a reminder. and you would just say, okay, WellBe, what's my reminder? And the reason there's different colored lights is you can set this up for an entire household. So a family can set it up for all of their, their dependents. If you're an adult child and you have a parent that you're a caregiver for, you can set them up on it for that, and you can get their reminders as well. So it really is interactive for the whole family if necessary. And the really nice thing, if you're buying it for your aging parent or something like that, there's remote setup. So you can set it up remotely. You don't have to be there for them. So if you buy the speaker for your mother or father, you can set it up for them. So that's the speaker. And this is what I talked about. The speaker is now also a standalone PERS device, where you often know PERS devices to be like watches or pendants. Our speaker is also a PERS device where you can just simply say, okay, WellBe, call emergency, and it will call emergency services for you. Our second product is our watch. This is really a nifty product. It's kind of slick looking. It kind of looks like a state-of-the-art watch. So a lot of people don't like to wear anything that looks too bulky or looks like that screams medical alert, system. So this also is voice enabled, so you can interact with it with your voice. It's got 24/7 emergency services. What's important sometimes as people are aging is they can't see as well. So it has a large high resolution display, so it's easier to see. We have T-Mobile as our 4G coverage. The device is water resistant. It also has a heart rate monitor and a pedometer. And it has GPS location. So you can, if you're a caregiver, you could ping it and find out where the wearer of the device is. And as I said, it is voice enabled, so you can ask questions. You can get medication reminders and appointment reminders. And also there's fall detection available. So if you are concerned about falls, which a lot of people are, you can have that added as an option, and that would go to emergency services. It's also available in an enterprise solution to have WellBe chat as well. So that's the watch. And then our other devices are medical alert pendant. It has all the voice capabilities of our speaker and our watch. It has also got two-way communications. You can, press a button and talk to it and call somebody. And if you fall, it has fall detection. It will go to emergency services. You see, and we wanted to make it smaller. A lot of those medical alert pendants are large, and we wanted to make it a little bit more sleeker. It kind of looks like an Apple product. It comes with a lanyard. You could wear it around your neck, or you can clip it to your belt. So it's easy to carry around with you. It is shower safe, water resistant. And as I said, it has the voice prompts. It has the WellBe virtual assistant where you can ask questions, and it has the WellBe chat capability as well. Just recently, we added Spanish capabilities, which we're really proud of offering that, because not a lot of these devices have Spanish capabilities, and it really is an underserved population. So we wanted to make sure that our devices would be able to converse and speak and communicate with the user in Spanish. And then I talked a little bit about the WellBe chat, and the talking about how a lot of seniors feeling isolated and lonely. And this device can be used as a, interactive communication. It's extremely intuitive. So as I said, it remembers what you were asking and builds that conversation. So you can ask it all kinds of questions. You can keep the conversation going for as long as you want. And, you can do things like ask WellBe to create a song or tell a joke or learn a recipe. So we really think that the WellBe chat is, really stands us apart from the other medical alert devices. And I think what's really important is, as I said, we're a Microsoft partner, so we're taking full advantage of their capabilities. So a lot of times you can get involved with a chat system that can have inappropriate content or misuse. Well, Microsoft behind the scenes is monitoring that and making sure that all that content is filtered so it's not inappropriate. And there's multi-level security. The chat is HIPAA compliant, just like the rest of our platform is. And you know, the Azure includes a reliable content management system. So when you ask questions, you're getting reliable content. So if we have time, I would like to show you a little video of that chat feature. So I'm going to just stop sharing for a minute. And okay, oh, let's see if that works. All right. Can you see that chat video?
Yes.
Great, thanks. Okay.
Okay, WellBe. Let's chat.
Great. What would you like to talk about?
I just moved into this retirement community here. I don't know anybody and I'm getting kind of lonely over here.
That sounds tough. It can be difficult to adjust to a new place and make new friends. Have you tried talking to any of your neighbors? It might help to start a conversation and get to know them better.
No, not yet. I don't know. I'm not really a people person.
That's understandable, and it's totally okay to feel that way. Maybe you could start off by doing something simple like going for a walk around the neighborhood and seeing if anyone else is out and about. That could be a good way to start getting to know people in the area.
Well, I have a bad back, so I'm not really crazy about going for a walk. Any other ideas?
That's okay. There are lots of other ways to get to know people in the area. Join an online group of people who have similar interests to you, or join a local club or organization that focuses on something you're passionate about.
Nah, I'm not a club guy, and I'm not really all that good on the computer. Although I am passionate about theater.
That's okay. There are still plenty of ways to get involved in theater that don't involve clubs. You could look into seeing local plays, volunteering at a theater, or even taking classes. That could be a great way to make connections and deepen your understanding of the theater.
My granddaughter is going to be Maria in West Side Story, but they live a couple hours away now at this point, and it's going to be hard for me to get there.
That sounds like an amazing opportunity for your granddaughter. I'm sure she's very excited. It's great that you'll be able to celebrate with her even though you can't be there in person. Have you thought about doing a video call or sending her a gift to show your support?
Well, I would like to be there. What about flowers? I was thinking about flowers.
That's a great idea. Sending flowers is a lovely way to show your granddaughter how much you care. You could even include a special note or card to make her feel extra special.
I'll tell you what, can you create a little poem that says something about her being in the show? Her name is Samantha.
Sure. Here's a poem just for Samantha, your talent in West Side Story. It's clear to see and hear, your talent's bound to take you far, and show that you hold no fear.
Thank you so much, WellBe. Those were great suggestions.
You're very welcome.
Okay, so I think that gives you a good idea of the chat feature. So I wanted to make sure you saw that. And just to, close out, we're really trying to address the challenges of people aging in place or aging within senior living communities. We want to give them state-of-the-art technology that can be used by caregivers as well as the seniors aging in place. And it was really important for us to remove the language barriers for Hispanic Americans and to address the isolation and loneliness that seniors can sometimes be challenged with, as well as most people. And it also, we felt it very important to keep people well. So we wanted to help them and increase compliance with taking their medications and making appointments. This slide, and by the way, Barbara can share this deck with you because I sent it to her. So you will have this if you need it. These are just give you an example of some of our key clients and partners. And then this is some independent reviews that HandsFree Health has received from like a PC Magazine and Tech Enhanced Life, kind of gives you an idea of how we're being received out in the market. And then also come some awards that some of our leadership has received and some of our products have received. And these are all live links you can click on if you wanted to read more. So that's my little presentation. So I'm going to stop sharing now and then see if anybody has any questions.
Feel
Can
free to
you give
unmute yourself if you want to ask a question. I was just going to say.
Yeah.
Can you give us an idea of cost? Just, ranges and
Sure. Actually, what anybody from Village to Village is going to be getting a 10% discount off of, if you go to our e-commerce site on our website, you'll get a 10% discount off of the devices, off the monthly subscription, and you'll get free shipping as well. And so the prices will vary. Like our speaker is going to be, I don't have it off the top of my head, it's about $119. And the monthly subscription is about $19.95. And then the watch is like $149 and the pendant's like $119. And then they have monthly subscriptions as well. But as I said, as a Village to Village partner, you'll get the 10% discount and the free shipping.
one of the comments that I've had from villagers, a lot of them have smartwatches, like the Apple iWatch or, Fitbit or, something like that. And one complaint that they have is that it's too complicated. There's too much there. So I think it's probably good to have something that is a little bit more narrowly focused so that it's not quite as overwhelming for some of the seniors.
That's a great point, Margaret, if you don't mind me calling you Margaret.
Sure.
We did like a test study with seniors in senior living communities. And it was surprising how easy it was for them to use and to set up. Some of them did need help. And our team is always there to help if somebody has a device, the speaker, the watch, or the pendant, to call and get help with setting it up. But it's relatively easy. And as I said, a person can set it up for that senior if the senior's having trouble with technology and they have a caregiver or someone that helps them. It can be set up remotely.
So when WellBe makes an emergency call, does it go to the local 911 or does it go to a monitored center that you run?
It's a good question. It goes to the monitoring center that we work with.
Okay.
Nancy, there was a question in the from Susan. Susan, you want to ask it or you want me to ask it? Either way. Well, she asked, okay, I can ask it. No big deal. Easy. For how long has the company been in business? Which I think you did in the beginning, and what kind of, this is a good question. What kind of hand holding is available for users? Which I'd be one of those, people.
Yeah.
Technology is not my friend.
Yeah. Our company started in 2016. And we've come so far since then, but I think the pandemic was actually a blessing for us because it gave us time to develop and get as far as we've gotten where we are right now. And as for the hand holding, as I said, we have a number that you can call and our team will always get back to you, and they are so attentive. That's the one thing that's very important for us because we know technology can be challenging. They will hold your hand. So we have a team internally that will do that.
I have another question. Oh, no, go ahead. You go ahead, Nicoletta, because you haven't moved yet.
Margaret, definitely. I'm going to chime in for like 2 seconds and say, you all know I ran a village for, I don't know, 8-10 years in Northern Virginia. And we had a very, very hands-on office. I had, a coworker, Betsy, who works for me now, or us now. But I had we had a lot of solo agers and adult children that live far away. And, you know, however you define solo aging, you know, she was widowed. And her biggest concern was, wonder if I need help in the middle of the night. I can't just call Mount Vernon at home. You know, you're all not going to pick, you know, wonder if I land in the, you know, I need, you know, emergency services. My daughter lives in Florida. You know, this is the type of thing, as far as I'm concerned, peace of mind. And, you know, I like the capacity that it is, got the HIPAA compliance in there, because I think most of our villages are looking for secure places where we can store information and be safely, you know, assured that it's, you know, very compliant. Margaret, go ahead.
Okay, I was going to ask how many customers you have now, and you know what your market penetration has been.
Yeah, we have about 5,000 users out there right now.
Mm-hmm.
And then that's just on the individual. Because we also, and this is something to think about, if you have any connections at like senior living communities or assisted living communities, we also are making our headway into those. There are enterprise solutions where a lot of these communities are looking for a solution for all of their residents or for a portion of their residents. They worry about wandering, so we can, at that kind of level, we can customize. So we also have a commercial side of the business as opposed to people just buying off our e-commerce site.
Okay, and one more practical question from somebody who has tried several different solutions. An ongoing problem is always recharging the batteries. You know, so how does that work? You know, if you have to take the pendant off for a certain period of time every day to recharge it, then it's not a 24/7 solution.
Both the watch and the pendant, because we have the voice capability and it's storing a lot of data, it would need to be charged usually every 24 to 48 hours. So what a lot of people do, because the speaker is in-home, they'll buy a bundle. So they'll get the speaker for in-home use, keep it in the bedroom or wherever is most convenient. So whenever they're not wearing their device, whether it be the pendant or the watch, whatever they choose, they'll have the speaker as a backup for emergency services.
Okay, and it's said that both the pendant and the watch are water resistant, so you can wear them in the shower.
Yes.
Okay.
I just have sorry, Nicolette, just a quick question that made me think about this. Does the pendant or watch have a built-in fall detection?
Yeah, that is an option. So if you were to go onto our website and buy our devices, it would say fall detection if you want it, and you can add it. Yeah, so they both have fall detection available.
Okay, interesting.
And is it customizable? Because I have fall detection on a watch that I have, and I had to train it that when I was walking my dog, sometimes she jerks my arm. And so I had to train it that was not a fall. So is it customizable like that, or is it, you know, you just take your chances? And what happens when there's a fall?
There's nothing that we can customize like that, but it's pretty accurate to detect a actual hard fall. So, you know, it typically doesn't go off for like simple things like that.
Mm-hmm. Good. And when it alerts, it connects you to your emergency center, and then they talk to you and they say, "Did you fall?"
Yeah, it will ask you first if this was really an emergency. So you have that opportunity, maybe if it was a mistake or an accident, to stop the call. But then, confirm it will go to the call center, and then they'll ask you, is this an emergency? And you go from there.
Mm-hmm.
And I'll tell you.
I'm sorry, Nicoletti, I keep jumping in front of you. I apologize.
Oh, no, we'll let you go in a minute, Nicoletti, but I have to tell you, it's funny because one time I like threw it in my purse and it called emergency services. The next thing I know, it's like there's an ambulance coming to my house, and it's like, oh my God. So, you know, it's receptive in getting an ambulance to you if you need it. And if you don't respond, if a fall is detected and you don't respond, it will automatically send an ambulance to your location.
Yeah, we had one of those. My neighbor dropped it in her car when she, came back, pulled into the garage, and she dropped it in her car and then went into the house. So, so it was sitting there in the car all by itself, and
Yeah.
it thought it was an emergency.
So there's 24/7 monitoring. I mean,
Yeah.
if you fall in the middle of the house, and I missed it. I had to miss a little bit of the presentation. Can you just use the watch, for instance, and not have the speaker? They're separate in
Yes.
terms of buying it.
Yes, you're right. You can have the watch, you can have the pendant, and you can have the speaker all separate. You don't need to purchase one or the other. You don't need to purchase both. Some people do like to bundle the speaker with either the watch or the pendant, because then they have that at-home device and then the on-the-go device of the watch or the pendant, but you're not required to.
And I did see a monthly cost, a cost of $119, and that was to buy any of the devices.
That's for the speaker.
Okay, and the watch?
That's around $149.95, and it's all on our website. But again, remember, you're going to be getting a 10% discount on the devices, the subscription, and no shipping.
And the website, because I missed that.
That's okay. It's HandsFreeHealth.com.
Okay, thank you.
Yeah. So I'm going to let Barbara know when it's all set up, because I have my folks working behind the scenes to get your promo code set up so that when you went onto our website, you can put in that promo code and get the discounts.
That's good.
Yeah. Any other questions?
Probably not yet.
Yeah. Comments, thoughts, anything?
Well, the only other thing that comes to mind for me is how interactive would it be with Office software? And I don't think you may be able to answer that.
I'm sorry, say that again, Barbara. I didn't get what
So
you
we
meant.
have software vendors that, we have a lot of back office, a lot of interactive things, and I'm wondering how compatible it is, like reporting wise. And I'm just saying, like, let's say somebody fell or somebody needed to go, there was a situation. Is there a notification process via email or electronically or whatever to notify the village or whoever they designate?
Well, that would be a whole different setup. We do have a portal where when somebody is managing numerous devices, they would be able to track that kind of stuff, and they would get notifications of a fall or an emergency. But when we're selling them one-off, like from our website, that portal does not come. So the only people getting notifications would be if somebody was set up as a caregiver. But if the village wanted to be set up that way, that would be a whole different, setup.
Okay.
Yeah.
I'm not sure we'd want to do that in our village. I think we'd rather just have our villagers interacting directly with WellBe and do it that way, and let the villager be responsible for notifying us if there was an issue or something, if something happened.
Yeah.
I
Yeah.
agree. But that does bring up one thought. In a village such as I represent, if several people bought the device, is there some sort of bundling cost or a cost discount because there's more than, there's 2 or 3 or 4 or something of people who are going to buy it at this time?
Yeah. The pricing you get, there is, if you look on our website, there is bundled pricing where if you buy a speaker and a watch together, or if you buy a speaker and a pendant together. But that's the only bundling pricing that we offer at this level. As I said, for an enterprise solution where, you know, there's a certain amount, like a large quantity being purchased at once, then we talk about group pricing as opposed to just our e-commerce pricing and the discount off of that. As I said earlier, like if we're in a senior living community and they're buying 100 watches, then they're going to get a totally different price than off of our e-commerce site. And they'll get the portal where they can manage those devices as well. Does that make sense?
Yeah. Emily, do you have a question?
Oh, yeah, I had a couple of clarification things. One is I have an iWatch and have had it quite a while, and the type is just way too small for me to read. You said it's larger on an iWatch. Can you adjust the size? Like, you know, there are accommodations that can be made. And the other is, I've never had it alert me to a fall, but I've had many false notifications. Luckily, I caught each one of them, and so no ambulance came, but that is a concern. You said it will learn me?
Well, I was talking about the learning about you when we were talking about chat and voice recognition when you're interacting with your voice. There's layered security where if it doesn't recognize your voice, it will ask for a PIN. But as for the size of the watch, we only have one size watch and it is the size. We're looking into getting different sized bands if people want different bands. So that's for the future. So does that answer your question about the size? I mean, it has a nice round face where you're able to read it easily, and we did that purposely. So hopefully the resolution and the image is good for you to read. And then as for the fall detection and getting false notifications, that's why we took a lot longer to perfect our fall detection, because we were getting, a lot of people were complaining with other devices that exact problem, that they were getting a lot of false starts. So ours is pretty reliable, and we haven't gotten a lot of feedback on that being a problem.
And my question was really the typeface size on the watch.
Oh, I'm sorry. I misunderstood what you were saying. There's only the one typeface size on the watch.
But it's larger than an Apple Watch provides?
Yeah.
I have another question about around that fall issue. I do an exercise program, and of course, that would be a good time to wear it in case I fell during exercise. But I wonder about it reporting false information if I don't fall, but I'm just moving.
Right. It should be reliable. As I said, it typically only goes off when it's a hard fall. So exercising, you should be fine. It's not like you're like making I'm sure you're not jerkily exercising, so you should be fine.
One of the things that the Apple iWatch does is it monitors your sleep. Does the watch monitor the sleep for you?
No, we don't have sleep monitoring. We just have heart rate monitoring and a pedometer at this point.
Okay. And how does it said something about glucose monitoring and weight monitoring? Is that something that you just tell it, hey, I weighed myself this morning and I weigh 100 pounds?
Yeah, you can. It would be self-monitoring and self-reporting. We do have the ability, again, if you have a solution for a large organization, where we can pair it with things like glucose monitors and blood pressure cuffs and scales and things like that. There is an integration package, but we don't sell that off of our e-commerce site. That's a commercial solution.
Right.
But one thing I did forget to tell you is coming in 2024, we are adding some AI wellness capabilities. So it's going to be like a behavioral pattern analysis and assessment and predictive decisions support. So we're going to be able to monitor an individual's emotional and physical health and without human input. So the kind of stuff you're asking about, like sleep monitoring and all that, that kind of predictive analysis for helping and managing a person's health is going to be coming in 2024. Yeah. I even printed this out so I wouldn't forget to tell you that.
So actually, Susan had another question. What's the what kind of repair record do you have for the devices? And what kind of guarantee do they have? Are they replaced? Can you repair them if they break? Blah blah blah. So.
Yeah, if they break, you can return them and we will replace them. Again, we deal with a lot of PERS dealers as well, like, you know, organizations that just sell our product. And we have not heard a lot of reports of people having service issues at all. So, but certainly we stand behind our product. And if something was wrong with it, you could return it and get a replacement or get a refund.
Do you actually? Go ahead, Nicoletti, because I jumped in front of you so many times.
Is it possible to try it for a period of time and then if it doesn't suit you, return it?
Yeah, we typically can send out demo devices so that you can check it out. So yeah, if you wanted one, we could send you out one.
So maybe the village could borrow one device to check out.
Yeah. Yeah, we're not going to send out like a dozen demo devices.
Right.
We send out, you know, a watch and a pendant, or if you want a speaker, we'll send them all out for you to. And if you wanted to share them, you could.
And so what you would do is pay for those, even if it's a demo, pay for them and then get reimbursed, or how would that work?
No, we for potential customers, we send out demo devices for nothing.
So do you actually get like a T-Mobile cell phone number?
You know what? I am so not technologically savvy in that way. I know it goes to our chief operating officer and she sets it up, the whole demo device, before it's sent out to you. So we'll be ready to use when you get it. That's what I do know. It's not a number that you can have people call. I mean, you will be assigned a number, but it's only for you to be able to call out. It's not for people to call into you.
And do you have to predefine the calls that you make out, like set up your list of these are the caregivers that I might call?
Yeah, what we have is called our administrative companion app that you would download from either the Apple Store or Google Play. And that's where you would set up like your profile. And if any family members are going to be included in that profile for the speaker. And you can set up emergency contacts, you know, whether it be, you know, whoever it is, you can set up anybody, a friend and a loved one, a neighbor, it doesn't matter. You can set up emergency contacts and call out to them. So you could say, you know, call Nancy, and it will do that.
And is there a limit, like you can only set up 3 or something?
No.
As many as you want. Okay.
You probably said earlier, but where is your company located?
We're located in Pennsylvania.
Okay.
Outside of Philadelphia.
Where I am, we've had frequent power outages at certain times of the year. Is any of this affected by that? I guess you couldn't recharge your device.
Yeah, the speaker requires Wi-Fi. Excuse me. The watch and the pendant do not. So the speaker's in home anyway. So you will need Wi-Fi for the speaker, but the watch and the pendant are 4G. So they're on the go and they don't need Wi-Fi.
Then is it rechargeable that, I mean, you just plug it into an outlet and,
The speaker or both or
oh,
all?
no, I guess I'm thinking about the watch. How would that?
Yeah, there's a little docking station for it. So you would plug that docking station into an outlet and then just plop the watch on it. It's like magnetic and that's how it gets charged. Same thing with the pendant. They have a little docking station that you put it in, plug it into the outlet, and that's how it gets charged.
And how long does it take to be charged? Because at that point, it's not usable to you.
Yeah, it will. The good thing is you get notifications when it's way before it's going to be totally out of power. So you're alerted beforehand. And it takes like no time at all to charge. It's pretty quickly charging, a couple of hours to maybe 4 hours. It's not bad at all. The charging's pretty fast. But we do recommend trying to, if it gets down, don't let it get down below 20%. And you'll be notified.
And that should be every 24 to 48 hours.
Yeah. Depending on how much you're using. If you're using a lot of data on the watch and the pendant, because the pendant as well, you can interact with it with your voice and you can say, hey, where's the nearest Italian restaurant or whatever you want to ask. If somebody tends to use those features a lot, it may be the 24 hours as opposed to the 48.
Well, overnight is the best time to do it anyway, if it's not going to be monitoring your sleep anyhow.
Exactly. And you have if you have the speaker, you have that for emergency services.
Mhm.
Except if you fall getting up to go to the bathroom.
Yep. Yep.
That's right. Yeah.
Thank you so much for all the good information. I apologize. I've got to bounce now. I've got a meeting with the board of my village at 2:00. But thank you so much, and I do appreciate learning all about it. This sounds really great, and it sounds like a much more robust AI solution than many of the other things that I've seen on the market. And
Yeah.
the pricing is very competitive too. A lot of them, you're talking close to $1,000 by just to get started with them. And so this is much more reasonable. So
thank you for
I
that.
definitely appreciate it.
I appreciate you being so interactive, and I appreciate everybody asking all the questions. And if you have any other questions, you can certainly go to Barbara and she can come to me. Or if you want to call me directly, when she gives you the deck, my phone number and my email address is on the deck, and you can always call me or email me. So, feel free.
Okay, Barbara, you have everything you need to send this to us?
I do, but I'll get the rest from Nancy. I'll get I do have the presentation, but Travis will turn it around for you.
Okay, great. Thank you so much.
I
Bye-bye.
have one suggestion for you. When you're thinking of what else you can do for your watch, for your capabilities, is have a button on the watch where you can enlarge the type.
Where you can what? I'm sorry.
Enlarge
the type.
Right.
I definitely will bring it back to our development team and see if it's something that they are thinking about already or working on or not. So I definitely will bring it to them.
Thank you.
You're welcome.
In your illustration, it looked as though the typeface is already larger than it is on an iWatch.
Mm-hmm.
I don't know if that's so, but
yeah. Yeah, we wanted to make it easier for, whether visually impaired or seniors who, need to have bigger, myself, I can't see for anything. So I need large type. I need lots of light and large type. Anything else?
No, but I thank you. I need to leave now, but it was very informative and I thank you.
Oh, thank you, Nicoletti. I appreciate you being here.
And I thank the village.
no problem. Quick question. Susan asked if you have a side-by-side picture of your watch versus watch. Oh, I don't know what that means.
I don't know. We don't have a side-by-side picture of our watch.
Oh, I watch. Oh,
Oh,
Oh.
yeah. I don't have any image. I'll check, but I don't think we have any images of our watch next to another brand or whatever. So I don't think we do, but I'll check.
okay. Yeah. All right.
There's
Yeah,
an
there's an iWatch.
my wrist.
There's my iWatch. Yeah.
Yeah.
Any more questions? This has been productive. Very good. Thank you,
Yeah.
Nancy. We really appreciate it. We will get materials out as soon as this video downloads. We'll also have it so that maybe you can share with your own village, members, and so they can see it too. And then we will send along with it the PowerPoint presentation. So,
Yeah. And what I'm also working on, so everyone can have it, is a marketing flyer that will show all the products and then also have a link to the landing page. So then I hope it will bring you right to where your discounted price is, as opposed to having then to go to the cart and put in your sponsor code. So I'm working on that. But you still can go right now today and go to, if you put stuff in the cart, go to the cart and just put in Village 10, you'll get the discount today. But I'd like to create a nice piece where you'll have it and you can hand it out to people and they can go to that landing page themselves.
all right, good. Excellent.
Okay. Anything else?
Thanks. Anybody else?
Well, I really appreciate you all giving me the opportunity to speak with you today. And I appreciate the interaction too much. It's so much. I mean, it's always good to have a conversation. So thank you.
I enjoyed it very much. So thank you.
All right. All right. Well,
Have a
everyone
great rest of the week.
day. Okay. Bye-bye.
Happy Veterans. Thanks.
Yes.